Now, let us look at another discussion today about degenerative disorders. And we are going to look at only the 4 types of these ones. That is Parkinson'S disease, Alzheimer's, Huntington's disease, and multiple sclerosis. So, what is degenerative disorders? This is as a result of continuous process based on degenerative cell changes affecting the tissues or organs, which increasingly deteriorate over time, resulting to abnormal wearing of the life choices such as exercise and eating. That means it interferes with the social life of the person affected. So our first topic is about Parkinson's disease. Parkinson's disease is a progressive nervous system disease marked by tremor, muscular rigidity, and slow, paced movement, chiefly affecting middle-aged and elderly people. It is associated with the deterioration of the basal ganglia of the brain and the deficit of the neurotransmitter dopamine. So in this case, there is reduced dopamine. So what causes Parkinsonism is not well understood, but it is associated with progressive impairment or deterioration of neurons in the brain as the substantia nigra point, which is the functioning normally the neurons producing diatrium of the brain known as dopamine. The nigra, the substantia nigra, is the one which produces dopamine. So in this case, it is impaired. So what does Parkinson's disease occurs? How does it occur? There is theories that it is genetically related over time, but there's not enough data to that one. So there is a controversy about it. So we need a reasonable amount of info and data so that we can be able to conclude on that. So what are the symptoms? The symptoms of Parkinsonism is that there is movement disorder which is progressively slowly. And in some cases, there is not difficult to notice weaknesses, walking difficulties, and also stiff muscles. Others, we may notice tremors of the head and arms. Parkinsonism progressively disorders and the symptoms of gradually worsening. And the dangerous symptoms of Parkinsonism disorders are: number one, slowness of the voluntary movement, especially in the initial stages. Movements such as walking and rolling over in bed becomes slow. And also there is number two, decrease in facial expressions, monotonous speech, and also decrease in eye blinking. Number three, there's unsteady balance, difficulty releasing from sitting positions. Number four, there's abnormal tone or stiffness in the trunk and extremities. Number five, there's a problem in swallowing that happens in late stages. Number six, there is light-headedness or fainting when standing. That means when you stand, somebody falls down, and that is called orthostatic hypotension. So in stages of Parkinsonism, there are 5 stages. And the stage number one is that there is mild form of Parkinsonism. At this level, the symptoms are a little bit difficult to see them unless you are very keen. These ones, they are not enough to interfere with the social daily activities and lifestyle. And this one can be missed in general examinations. In stage 2, there is considerable moderate form of Parkinsonism and the symptoms are much less disturbed and those experienced in stage 1. For example, at this stage 2, the patient will have stiffness, will have tremors, trembling may be more noticeable, and the change in the facial expression can occur. Where muscle stiffness prolonged task and completion, so the people take a long time before they finish what they are doing, and this one that stage 2 does not impair a balance. So in stage 2, there is no more balancing, but the task you have been taking to do within 2 hours, it can take longer time to do it. Stage 3 is, in this stage, there is middle stage Parkinsonism, and it marks a major turning point in the progression, because in this case, there may be the same system in stage 2, and now there is loss of balance and decrease in reflexes occurs. And in this case, many people fall down. Then stage 3, 4, stage 4 is very independent from others, because patients in this stage, they have to be assisted to stand up. However, movement patient may require a walker, or may require some assistance devices for them to walk around in the house. Stage 5, it is stage which is advanced with debilitating signs of Parkinsonism. There is advanced stiffness in legs, and also causes wheezing upon standing. Patient require a wheelchair and often unable to stand without falling. Around the neck, critical assistance is required to prevent fall. So, Parkinsonism treatment, there is no cure, but you need medication to control the symptoms, and often dramatically. In some cases, it may require surgery interventions. So medications can help manage problems like walking, movement, and tremor. And these medications increases or substitute dopamine, because in our case now, the patient have raw dopamine. So in this case, we have to increase the number of dopamines, and this one, because they are the signaling chemicals in the brain. So the drugs used in treatment of Parkinsonism are called carbidopa, levodopa. Number 2 is carbidopa, levodopa infusion. You can give dopamine agonist. You can give MOAB inhibitors. You can give cathepsin or mineralotransferase. That's an enzyme inhibitors, and collagenase and amantadine. So you can also do surgical procedures like deep brain stimulations using implanted electrons in a specific part of the brain connected from the chest. So the second type of disease is called Alzheimer's disease. Alzheimer's disease, it is also in other ways called it's called a vascular dementia or type 3 diabetes. It is associated with the cell death of the brain, which can result to decline in cognitive functioning. This one is because of a problem with the we call them neuropeptides, and it starts in mid-range and gets progressively slowed. The causes of angina is like any other type of Alzheimer, is caused by brain death and the neurodegenerative of neuropeptides. So the total brain cells shrinks, the cells become few, more brain cells die, and Alzheimer leads to significant brain shrinkage. When doctors examine the Alzheimer patients of microscope, they see 2 types of abnormality that occur considerably the mark of this disease. There is plaques and tangles. Plaques are beta amyloid proteins which destroy brain cells in several ways, including interfering to cell communication like chemokines. Although the ultimate cause of brain-to-cell death is not known, a collection of beta amyloid can also be suspected one. And also the other one is tango, which is interferes in internal support and transport system to carry out nutrient analysis nutrients through the brain long extension. And this one is called protein called tau. Now there is what is called enzyme called tau phospholipase, which breaks down the tau. also plays a big role in this type of problem. So this type of patient can be associated with diabetes because of atherosclerosis in the blood vessels supplying the brain, or the positions, or even sometimes uh, um, narrowing of the blood vessels in the brain, or even spasming, resulting to a vascular impaired blood supply to the brain is also stated. This one, that is the reason why this condition is called type 3 type of diabetes. So in this case, the patient will have a lot of forgetfulness, blood confusion, and over time the disease may cause memory or problems of recent memories, and later attributed patients symptoms worsen and depends on patient are lost the environment they are in. So Alzheimer, sometimes patients have difficulty remembering things and also organizing a lot, and you may not recognize anything that is wrong, even when changes are noticeable to your family members, close friends, or co-workers. So that is how it looks like. So there are stages in Alzheimer, like in stage 1, that is early stage, it lasts 2 to 4, memory loss, particularly on recent conversation and events, repeated questions and problem expression and understanding languages, brain coordination problems and writing and using objects becomes difficult. Depression and apathy can occur and accompanied by mood swing, and also need reminders for daily activities, and also require and have a problem in driving. In stage 2, this is moderate mild and can no longer come up with problems. Pervasive and persistent memory loss, including forgetfulness about personal history and inability to recognize friends and families. Lumbering speech, patient comes with a lot of lumbering speeches, unusual reasoning, confusion about the current event, time, and place. Disorientation happens here. They are lost in the familiar settings like the house. They have problems in sleep and also change in mood and behavior, which can be aggravated by stress and change. Stage 3, there's severe and late stage. That's the one to more than 3 years. Confusion about past and present. Loss of ability to remember, communicate, or process information. Generally incapacitated with severe total loss of verbal skills, unable to care for self, for possible and more immobility, like problem with the swallowing, incontinence, and illnesses. And in extreme problem, mood problem, behavior, hallucinations, and behavior. In this stage, the person will need without the crowd for intensive care support. So how is Alzheimer treated? It's difficult disease to treat it. Current approaches is to maintain mental functioning, manage behavior symptoms, and slow and so delay or symptoms of disease. So this one requires rehabilitation. So there are diseases which are drugs which are used in management of Alzheimer, like polymerase inhibitors. There's momatin, like in Amenda. There's of drugs, and also we have omega-3 and the curcumin, which is on herbal, but no study which has shown in a trial which has shown that it is very a success in management of Alzheimer. So you have Gigok, is a plant extract, still requires some more studies to about it. Then you have vitamin A, but you have to be very careful about vitamin A because it can cause toxicity. The dosage is 2,000 grams of D, but that one you have to remember that it goes the blood barrier, so you have to be very careful about the toxicity of this drug. You have to be very careful. The other disease is called Huntington'S disease. This one is due to damage certain nerve cells in the brain. The disease progressively slows over time and can affect movement, cognition, that is perception, awareness, thinking, judgment, and behavior. So symptoms are like nervousness, like frightening, minor twitching in the fingers and toes, excessive restlessness, and sometimes clamminess. There is slight alteration in handwriting and minor difficulty with normal daily and physical skills and driving. So there's problems in emotion like short-term memory loss, inability to recognize, to organize routine tasks, or to cope with new situations. Periods of depression are than irritability and impulsiveness. There's no cure for Huntington's disease, and if the progresses can be reversed or slowed down. As the condition progresses, it will put a strain on family and relationship. The treatment for Huntington's disease aims to improve any mood disturbances, and this is done to maintain stress stability, to care, intermittent over time. So rehabilitation again is the key way of management of this type of disease. So medications for symptoms such as irritability, excessive movement, you have to do therapies, speech and language therapy for the purpose of these people to be able to communicate. Then the last disease is multiple sclerosis. It's an unpredictable, often disability disease of the central nervous system that disrupt the flow of information within the brain and between the brain and the body. In multiple sclerosis, damage the myelin floating around the nerve fibers in the central nervous system, and the nervous fibers themselves interferes with the transmission of the nervous signals between the brain, spinal cord, and the rest of the body. So there is no cure for multiple sclerosis, basically. So what is there is that you have to do a lot of speech therapy and also slow progression of the disease. Some people have little symptoms which does not require any treatment. So the treatment you can use corticosteroid, you have to be worried about the side effect of this corticosteroid. It only increase blood pressure and mood swings and fluid retention. So you can also do plasma exchange as a way of treatment. That is plasma paralysis. So basically, that is all about these disease we call them neurodegenerative diseases. Thank you for listening. And you know that after this, you're going to offer your patients good service. Thank you very much.